Hi, good afternoon, everyone. Welcome to another wellness webinar by Live Healthy Miami Gardens. My name is Melissa P. Dunn. I am the CEO of MD Marketing Network and a member of the Live Healthy Miami Gardens Communications Sub-Council. So, as you know, we have these conversations periodically where we talk about different topics really designed to help increase the quality of life for Miami Gardens residents and highlighting the expertise of partners like Jesse Trice Community Health Systems. And so today we have something a little bit different for you. We have a presentation by Dr. Dana Walker. She is a dentist on faculty at Jesse Trice Community Health Systems. And fun fact, she actually went to medical school in Trinidad and did her residency in New York. And she's really been in Miami Gardens for about 4 years. So I'm going to turn it over to Dr. Walker. Hey, Dr. Walker.
Hi, thank you, Melissa. Hi, good afternoon. Thank you so much for having me here. I feel very honored to be here to talk about our topic today.
Yeah, and today's topic, guys, is really about culturally competent care. You know, as members of the community, we really have to take charge of our own health and be our own health advocates. And in today's presentation, Dr. Walker is going to really share with us some tips and best practices for how we can what we should expect from our healthcare community. So, Dr. Walker, I'm going to stop talking and I'm going to turn it over to you.
Okay, thank you, Melissa. As Melissa mentioned, I am a general dentist at Jesse Trice Community Health System. We have several locations, but I am primarily located at the Brownsville site. So we host two residency programs here, one with NYU Langone and the other with Larkin Hospitals. So today, I know the topic was exploring the significance of culturally sensitive healthcare, especially during times of crisis. And we hope that today we'll be able to discover how healthcare providers can ensure respectful and effective communication with a diverse population and taking into account cultural beliefs and practices and how these things can influence health decisions. So just a bit of a background on Jesse Trice. Jesse Trice Community Health System became the first federally qualified health center in Florida and fifth in the nation 55 years ago. And our mission has been to improve the quality of life and achieve health equity for all by providing access to innovative, quality, and comprehensive primary care. So we have 11 comprehensive primary care centers, 3 oral health and wellness centers. We also have a women's residential center for substance use. And our centers are in some of the areas that were hit the hardest by COVID. Since we will be talking about culture and how culture has an impact on health choices and how persons can relate to their providers and how providers relate to patients, I wanted to start off first by mentioning what the definition of culture is. So culture is a general way of life. It includes the way we speak, the food we eat, the music we listen to, and anything that we may feel as though it's our norms. And these things are usually passed on from generation to generation. I like this quote by Audre Lorde. It says, "It is not our differences that divide us. It is our inability to recognize, accept, and celebrate those differences." So it's important now than ever as healthcare workers to be mindful to provide care in a manner that makes our patients feel seen, heard, and respected. COVID presented itself with many challenges, and because of these challenges, persons had to make very life-changing decisions. And we saw where many persons have moved, whether it's from one state to the next or from one country to the next. And this has provided an opportunity for a more diverse melting pot. So, with a more diverse population, we have to be very cognizant of differences in social norms and values. And some of the things that I would like us to discuss today would be, for example, vaccine hesitancy. Based on the area that we're in, there are certain persons who have been, we were one of the hardest hit areas in this community. And based on the numbers, based on the mortality, the morbidity, even though those figures were displayed, we saw a very large percentage of the population were very hesitant to take it. Quite understandably so, given historical facts of what has happened in our community since of African American descent. And so today we just want to talk about how different things and how different aspects of past and our culture and how different experiences can influence make decisions and how important it is for healthcare providers to be able to be accepting and understanding of these choices. Respectful. We also want to talk about the fact that in the zip code, there were few people who were able to work from home. And so this provided challenges in the sense that persons were not offered that opportunity to isolate. Again, this impacted the increase in the COVID rates. And so because persons weren't able to work from home, and also persons in this community, it has been shown a lot more persons from this community tend to take public transportation. So it's all these factors that we really have to take into consideration as healthcare workers when we're providing care to patients and when we are speaking to patients about their choices and their decisions that they're making. We also know that with COVID came changes in terms of inflation, the price of food, the price of basic needs, housing costs. And so what that ended up causing was that we had more persons who had housing insecurity, food insecurity. And also we had a lot of persons who experienced trauma from the death of their loved ones or losing their homes or being unable to meet financial obligations. And so we then need to explore how can we as healthcare providers be more culturally sensitive and more understanding of what our patients are experiencing and what their feelings are and how they're voicing their choices. And so one of the first things we need to do is we need to evaluate our personal biases. We need to remember that because of each individual has different experiences and different beliefs, these experiences and beliefs can influence how we see things. And we have to be very careful of that. We have to always be asking ourselves, am I thinking about this from the point of view of an objective point of view? Am I taking the patient's feelings into consideration? And we have to be very mindful because patients can sense when they're being treated with compassion and when we're being very understanding. We have to make sure we're paying attention to our tone or body language or pitch or voice, because all these things really do influence how patients feel and it makes them feel seen. So we have to make sure that we're looking at the patients eye to eye level, making sure that our backs are not turned, making sure that we're giving our patients our full undivided attention, making sure that we pause to listen. Even though things may get a bit busy, we have to remember to always give patients that time so that they could be able to express how they're feeling.
So, Dr. Walker, this is all fantastic information, right? So, considering that I'm a patient and I'm a member of the general public,
Right.
how, I think the tips giving about, how a doctor is supposed to treat a patient are really, really very helpful. But let's say that I'm in a situation where I'm talking to a provider and I'm not getting the information in the language that in my language, or that I'm speaking to the provider and his or her back is to me and I don't feel really seen or heard. What should I do? How should I handle that?
Um, that's a very good question. So I feel like one of the first things we need to do is and this is not just with the providers, but also with patients, it's really good to be able to first not necessarily think that it's being deliberately done. So the first step would be to say, "Excuse me, Doctor So and so. I feel as though right now your back is turned to me, and I feel as though I'm not being heard, or I feel as though you're not listening to me." I think, and usually most times people will realize, okay, maybe I'm not doing something right, and they'll physically turn, and then they will give you that undivided attention.
Yeah, that's super helpful because I'm thinking that if I'm a patient, for example, I'm from Jamaica, so our primary language is English. But if I were from Haiti, for example, and I'm a new immigrant and still communicate more comfortably in Creole, and I go to a medical practice and everything is only in English, the staff is only speaking in English, then do you think that it's my responsibility to then say to the provider, listen, I communicate more comfortably in Creole. Is there somebody that can speak my language?
So very good question. Do I think the onus is on the patient? I think it's more so on the doctor to be able to recognize that, because communication is language. If it's done, then it's easy for misunderstandings to take place, or for the patient to not even fully grasp what's taking place. And you cannot get full consent with patients understanding what is being presented to them. So it's very important that as health centers and as healthcare workers, that we provide patients with information in their preferred language. We should have signages in our facilities, which we do, and also our providers or healthcare workers should reflect what the population looks like. And at Jesse Trice, we do try to do that. We're located right now in Brownsville, and the population is predominantly, and we do have providers that speak different languages. The three main languages that are spoken in this area: English, Spanish, and Creole. And so we have providers that reflect that. We also have providers that look like the population. And we've been very deliberate in making sure that that's the case, because patients want to be seen. They want to know that there's someone who's able to understand what they're feeling. And, we also have to remember that patients have different cultural norms. And so maybe someone from that country may be better able to identify with the patients and to be able to better explain certain things.
Got it. Okay. Yeah. Thank you for clearing that up and for offering some practical ways that patients can really engage and, in essence, advocate for themselves, right? All right. Okay. So I know you have more slides. Go ahead.
So I would also like to mention that it's important that we not, as healthcare workers, we not label things as good or bad. Because again, different individuals have different experiences and beliefs. And so we don't want to come across as though we're judging anyone. We don't want to make it seem as though we, just because a patient decides something, that we can take our personal biases and then put that on patients, and that's not right. So we have to make sure we don't label things as good or bad. We just need to have an open mind. We need to be objective, and we understanding that patients have the right and the autonomy to choose. We should also make sure that we're giving patients options, again, to make sure that they have a voice in their treatment outcomes. Studies have shown that when this takes place, that patients tend to have better outcomes. We also want to, just as you had asked, provide information in the patient's native language, both the written and verbal. And so we find that when patients are communicating in their native language, that things are a bit clearer, and even circumstances that the patient may be experiencing, someone from that particular culture may be able to identify with that patient and may be able to direct the proper resources that may be helpful for that individual. Also, it's very important to listen to feedback given by the patients. And we want to do this in a way where it's not defensive on our part as healthcare providers. So we have to make sure that we're not putting a guard up. We're just listening to the patient, and we're trying to understand, being compassionate, being understanding, because patients feel, when we have different tones, body language, patients can feel, they sense when they're not being treated well. And so we have to be really mindful that what we're communicating is compassionate. And also, we just want to make sure that we're striving to be better than the previous day. And we do this by trying to continually improve upon our cultural competency skills.
So, Dr. Walker, since the primary target audience for this presentation is really the community, how can they adapt the tips that you're giving specifically for them? So what do they do if their doctor is not listening to them?
Well, if a patient feels like the doctor is not listening to them, one thing that could be done is, like I mentioned earlier, we can ask the patient can ask, doctor, I feel as though you're not listening, or like I'm not being heard. If that doesn't work, it's also up to the patient. The patient has the right to also request another provider.
Oh, good tip. Okay. All right. Fantastic.
So just to wrap up, opportunities could be to educate our patients about access, and to educate persons about vaccines, how they save lives and they decrease death. We also want to make sure we have signage in our medical and dental practices to reflect the languages spoken in the community. And if a patient feels as though their language is not present, they should be able to ask, and they can ask. And we must make sure that our providers reflect the population that is being served.
Thank you so much, Dr. Walker. So let's make this really practical, right? You can stop sharing now, and let's just have the conversation now that you've given us a framework on which to base the conversation. So let's say that I am, well, first of all, why is culturally competent care something that a patient should find important? Like, why is it important for me as a patient that I have culturally competent care?
So studies have shown that culturally competent care actually results in better outcomes. A simple example could be if a patient comes in and a patient expresses that they prefer not to use, I'll give an example, fluoride. In the dental setting, we use fluoride a lot. As a provider, I need to listen to my patient, and and if my patient is telling me, I don't want this in my body, as the provider, it's now my responsibility to be able to come up with an alternative for my patient. because I cannot push something on my patient that my patient doesn't want. I will not get anywhere.
Mm.
The patient will
That's so
not.
That's so powerful, Dr. Walker. And I think back to my grandmother, right? My grandmother migrated here from Jamaica. She came here when she was, she had already raised how many, 9 children and 12 grandchildren. So she really migrated here as an adult to give, the children, the grandchildren, the opportunity to get a green card, right?
Mhm.
And so she left Jamaica, came up here, went to work as a home health aide, as a lot of Caribbean immigrants do. And I remember going to the doctor with her. And I think for my grandmother being, of that generation and that culture, she's kind of afraid to talk up and to advocate for herself and to ask questions of the doctor because culturally it's just not something that we do. The doctor is the expert, and whatever the doctor says, and whatever the doctor says goes, and she'll come out with like a whole bunch of instructions, and if I ask her to explain it, she really can't because she doesn't have the confidence culturally to have that conversation.
And yes, you're right. And what we see happening in situations like that is patients, if they don't understand and if they don't agree, they won't follow through with the treatment plan. And if the patient isn't following through with the treatment plan, then the outcomes won't be desirable. And so we have to make sure that we have persons who are able to provide that care and that culturally sensitive care to patients. Because I agree, I am of Jamaican background, so I understand if a patient is going to the physician and the patient is saying, well, in my culture, we don't really take for high blood pressure. We may use garlic or we may use an alternative. I feel like it's important for that provider to be able to listen to the patient and give the patient the opportunity, of course, depending on circumstances, to see how best they could use what the patient feels comfortable. And then if that doesn't work, maybe try an alternative. So it's just
Wow,
that.
that's so powerful, Dr. Walker. And unfortunately, a lot of providers don't have that outlook or that philosophy, which is why this work about cultural competency training is so important, right?
It is, yes, it is. And lifestyle changes, lifestyle modifications, speaking to patients, getting an idea of what may be contributing to the issue, and then starting from there, different things can be done.
Yeah. And so the other thing that comes to mind too is cultural competency doesn't just extend to ethnicity and culture. It also extends to sexual orientation, right?
True, that is very true. Yes, it does.
I remember when I used to work in New York, we had a nonprofit that would literally come in and train providers on how to provide sensitive care or appropriate care for the LGBTQ plus community. And so that they feel safe and welcomed just like any other culture.
That's very important. We want to make sure that all persons, all individuals feel welcome and that they feel as though they're able to get that care that is individualized to them.
Fantastic. So I'm going to ask you to perhaps give me some take home points from two perspectives, right? Because I feel like our conversation today could be appropriate for the provider or the patient. So could you perhaps give me like a final word of wisdom, first for the provider and then secondly for the patient?
I think as a provider, as providers, we need to be very careful and very understanding of our patients. And we need to be able to tune into those individual specific facts that patients may mention and how those things can actually influence outcomes. Um, So it's just doing that introspective reflection, making sure that we're not using our personal biases and putting those on patients, but really genuinely listening and listening with the intent to understand the patient and then provide treatment from there. And I feel like from the patient's perspective, I think it's very important that patients become armed with information and with knowledge. We're in a time more than ever, information is literally at our fingertips. So patients have the ability to go and they can research. Um, I feel like patients need to be more involved with their care, asking more questions at the doctor's office, calling their insurance companies to find out what their eligibilities are like, understanding what's taking place, following up with things, having notes of what has transpired. Because as patients, we need to be more involved with our care and with our health. Because if we're not involved, then things get missed. It happens to the best of us. Things can get
Wow,
missed.
fantastic advice. Providers, be sensitive, patients get involved. I love it. I love it. Thank you so much, Dr. Walker, for sharing your wisdom with us. I know that in Miami Gardens, we are 100% committed to ensuring that we create resources, not just for the providers, but for the patients, right? So that we can all feel heard, seen, and welcomed. So thank you so much for joining us. And I will see you again in the community. And by the way, residents, please know that livehealthymiamigardens.com is always a trusted resource for local healthcare information. Thanks for joining us
Thanks
and
for
be
having
well,
me.
everybody. Bye-bye.
Bye.